So, Dr. Fenn, we have a lot of our listeners that are clinicians. How could they start learning more about EMDR, as well as if you could explain what EMDR really does entail? I know it's what it stands for, eye movement desensitization and reprocessing, but what does it really, what does that mean?
Sure.
What does a session look like? And then how can clinicians learn more about it and possibly start going to trainings and become licensed in that?
Sure. Well, let me start with how they can become trained in that. So there's an international and a national EMDRIA. So I think that's EMDR International Association that's where I got trained, and I think they're the largest training accredited facility, and they're all over the nation. So pretty much any city that you're in, if you look it up, you can Google it, you can see that there's I was trained in Tampa, and it generally takes 2 weekends, intensive weekends of training, and you start with one weekend, and then you have so many weeks in between where you work with what you've learned on your current client base, and then you come back and you have more of the advanced training with that, and then supervision for between 6 months or a year after with one of the EMDRIA instructors. So it's intensive, but it's highly beneficial for clinicians. I feel that if people are working in the field with people that experience trauma, if it's addiction, if it's behavioral health, anything that has to do with anxiety, trauma, PTSD, it's highly recommended that they be trained in that. There's also other techniques out there that have come since then, such as EFT. I'm not as familiar with that, but I can speak very highly about the benefits of EMDR and being trained in it.